For hepatitis B, prevention is more effective than therapy. It is 100 times more infectious than HIV. Despite the progress of antiviral therapy against hepatitis B virus, a cure for chronic hepatitis B virus infection is still not a common outcome. Hence, prevention of hepatitis B virus infection by immunization is the best way to eliminate hepatitis B virus-related diseases. Hepatitis B virus immunization can be classified into passive and active immunization. Passive immunization using hepatitis B immunoglobulin provides temporary immunity, whereas active immunization by the vaccine yields long-term immunity. To prevent hepatitis B virus infection effectively, it is crucial to understand its mode of transmission. Hepatitis B virus infection is transmitted through either infected person to another person or through a mother-to-infant transmission. You can watch our video on mode of hepatitis B transmission. The link is added to the description below. 3 main strategies are available for the prevention of hepatitis B virus infection. 1. Behavior modification to prevent disease transmission. 2. Passive immunoprophylaxis. Please don't worry about the jargon, the explanation is simple. And 3. Active immunization. This is the most important method of preventing hepatitis B infection. 1. Behavior modification to prevent disease transmission. You have to take precautions to avoid hepatitis B virus infection. These will include the following. Know the hepatitis B virus status of any sexual partner. Don't engage in unprotected sex unless you're absolutely certain your partner isn't infected with hepatitis B virus or any other sexually transmitted infection. Use a new latex or polyurethane condom every time you have sex if you don't know the health status of your partner. Remember that although condoms can reduce your risk of contracting hepatitis B virus infection, they don't eliminate the risk. Don't use illegal drugs. If you use illicit drugs, get help to stop. If you can't stop, use a sterile needle each time you inject illicit drugs. Never share needles. Be cautious about body piercing and tattooing. If you get a piercing or tattoo, look for a reputable shop. Ask about how the equipment is cleaned. Make sure the employees use sterile needles. If you can't get answers, look for another shop. If you're traveling to a region where hepatitis B is common, ask your provider about the hepatitis B vaccine in advance. It's usually given in a series of 3 injections over a 6-month period. The second method of preventing hepatitis B virus infection is passive immunoprophylaxis. In this case, immunoprophylaxis means giving protection against hepatitis B virus, which includes the use of antibody-containing preparations to provide a susceptible individual with immunologic protection against hepatitis B virus infection. Hepatitis B immune globulin is a sterile solution of ready-made antibodies against hepatitis B. Hepatitis B immune globulin is used in this passive immunoprophylaxis. Passive immunoprophylaxis is used in 4 situations. 1. Newborns of mothers infected with hepatitis B. Immunoprophylaxis is recommended for all infants born to hepatitis B virus surface antigen-positive mothers. 2. After needle stick injury, with a needle used for an infected person. 3. After sexual exposure. And 4. After liver transplantation. The third method of preventing hepatitis B virus infection is active immunization. This is the most important method of preventing hepatitis B infection. A safe and effective vaccine that offers 98% to 100% protection against hepatitis B is available. Most people who are vaccinated with hepatitis B vaccine are immune for life. The hepatitis B vaccine is typically given as 2 or 3 injections separated by a month or 3 or 4 injections over 6 months, depending on which vaccine is given. You cannot get hepatitis B from the vaccine. The hepatitis B vaccine is also strongly recommended for 1. Newborn babies. 2. Children and adolescents not vaccinated at birth. 3. Those who work or live in a center for people who are developmentally disabled. 4. People who live with someone who has hepatitis B. 5. Healthcare workers, emergency workers, and other people who come into contact with blood. 6. Anyone who has a sexually transmitted infection, including HIV. 7. Men who have sex with men. 8. People who have multiple sexual partners. 9. Sexual partners of someone who has hepatitis B. 10. People who inject illegal drugs or share needles and syringes. 11. People with chronic liver disease. 12. People with end-stage kidney disease. 13. Travelers planning to go to an area of the world with a high hepatitis B infection rate. Don't forget to like and subscribe, so that you can get notified when we release a new video. Thanks for watching. Now that you know how to protect yourself and your loved ones from the silent epidemic of hepatitis B, you need to know the available treatment options. Watch the next video on treatment and management options for hepatitis B virus infection.